You see taciturn, again, what does it mean? It means only is you will find in taciturn phase. Mostly they will be eloquent, talkative, like this. So this is the true phase of Lachesis in repertory. Now we find memory, weakness of memory. Maybe most of us, we don't think about Lachesis in weakness of memory. We think maybe lycopodium, maybe medorium, like this. But Lachesis is also in first grade, weakness of memory. So let us come to weakness of memory. Memory weakness. Memory. Memory, weakness of memory. You see, Lachesis first grade. You see, Lachesis first grade. You see here, Lachesis first grade. So even Lachesis has weakness of memory like medorium. Medorium first grade, also this is first grade. Then you find, I told you, this Lachesis, this extrovert introvert type, they alternate maybe in the same patient. In the morning, introvert state, in the evening, extrovert state. Or maybe in 2 months before he was extrovert, now he is taciturn. So there is also another rubric. This is called mania alternating with depression. Sometimes he is manic. He will beat person, he will scold person, and sometimes you find that he is depressed and depressed. So there is also rubric of Lachesis. We find this is called bipolar disease, this psychiatric disease, manic depressive psychosis. And Lachesis is a good medicine if it fits the patient to cure it. So mania. Sorry. Mania alternating with depression, you see. Mania alternating with depression. And you find Lachesis is the only medicine for the first grade. So we will think that we may find a Lachesis patient in manic phase, extrovert phase, or we may find him in the introvert phase. Both are Lachesis. So this is mania depressed, alternating with depression. This is the only first grade medicine, Lachesis. Now we come to the second symptom, suspicious. Lachesis too much suspicious, more than hyoscyamus. So let us see suspicious. I think it is better if you are very serious to learn. Well, when we learn mathematics, we are very serious. We take paper to note something. So here you can take your repertory with you, maybe cancer repertory or synthesis repertory, and you can learn. You can just find out, like me, the rubrics, and you can learn. And at the same time, you learn Lachesis more. So we will see suspicious. You see suspicious. Lachesis is so suspicious. You see, Lachesis first grade. But you see, by repertory, you learn mathematics more. Why? You see here, lycopodium. This is super great. So lycopodium patient is more suspicious than Lachesis. So by this rubric, you learn a symptom of lycopodium also. And lycopodium does not believe or does not, what I say, believe his wife. He suspects. Or lycopodium wife cannot believe his husband. When the husband comes a little bit late at night, she will not think that he was stuck to his. She will think that, oh, he may have gone somewhere else, something like this. So lycopodium is more suspicious. So you see, repertory gives you a chance to learn more medicine along with your the stipulated medicine. Now let us come refusing medicine to take. Lycopodium patient will not take medicine from you. Maybe his wife is making the medicine, say homeopathic medicine. He will not take. Oh, no, no. Maybe she has given some poison. So he refuses medicine due to his suspicion. Let us find a rubric: refusing medicine. Refusing medicine. Refusing medicine. Refuse medicine you see to take. You see, Lachesis is the only first grade medicine. Even Hyasamas is second grade. Even Hyasamas is second grade. Hyasamas is very suspicious. But Lachesis you find is a first grade suspicious medicine. He does not take medicine from his wife even. Then you find delusion. He has some delusion. He thinks that somebody is after him. They want to harm him. But there is nobody. There is nothing like this. But he thinks that people are pursuing him. Government is pursuing him. Police is pursuing him. They are following him to catch him in some fault. But this is delusion. The false belief. So let us see this one also. Delusion pursued he was. Delusion pursued. Pursued. Delusion. Pure. You see, delusion pursued. This is Hyasamas and more. Hyasamas is second grade, Lachesis is third grade. He was pursued. Now jealousy, we come to jealousy. Lachesis is too much jealous. And you find also there is another medicine, jealous. So let us see. That's why repertory is giving you more instruction. It is giving you cross-learning of mathematica of other medicine. So we find jealousy. Jealousy. You see, in jealousy, there are three medicines. Nux is first grade, also jealous. Then Hyasamas and Lachesis is super grade, means more than first grade. So these are very, very jealous. And Hyasamas and Lachesis, of course, it is easy to differentiate them, but it's some symptoms, they are very near. So jealousy, it is super great in Lachesis. Then you find censorious. Censorious means he criticizes others. We are told that these Lachesis persons are very critical. They always criticize others. We have also some friends. They always criticize other people. They are not good. I am only good, something like this. So these are Lachesis mentality. So we find criticize others. So you don't find criticize in repertory. There is term is called censorious, to criticize others. So we see CEN, censorious, you see. And one thing you see, one of my allopathic friend means he was the professor of government homeopathic medical college. He was professor of community medicine. He started one postgraduate diploma course in his institution, and he took me also as a teacher. This Mosinuzzaman, then Diman, I think, then Ikhtiaruddin, maybe they were our students at that time in that course. So he was an allopath, though he was teacher of homeopathy college. He said, "Oh my God, to learn homeopathy, it is so tough. Very good words, English words I am learning from homeopathy." And you see, these words, these are very chosen words which express the inner sense of the patient. So always when you are dependent on Bengali book, you don't learn the essence of homeopathic medicine. So you'll have to try to learn more English to learn more homeopathy and more homeopathic materia medica. Sensorious here Lachesis is second grade. You see, second grade. More are viridatum and then sulfur and arsenic. Censorious. Then we find mocking other mocking. You laugh upon others. You will make story and make other people low. This is called mocking. Upahas kora, thatta kora, bidrup kora. This is mocking. So let us see mocking. This was in our repertoire also. So let us see mocking. So you have to learn these words also. Mocking. You see, mocking, Lachesis is second grade. CPI is first grade. Mocking. Then you find this is called malicious. This is a very important symptom of Lachesis. Malicious. Malicious means to think of bad of others. That Anwar Patwari is very bad one. And he will say bad words about him to others. Don't mind Anwar Patwari, just I mentioned the name. Maybe he will say, oh, Dr. Farukal is very stupid one, notorious one. He does not know homeopathy more. He came from allopathy and he gives allopathic medicine along with homeopathic medicine. He will say something like this. Why? To undermine others' personality. He wants to increase his personality and by the exchange of others. So this is called maliciousness. Also another term, vindictiveness. Pratihingsha pora. He want to size others. Then spiteful. Also like this. Akrushporo. Spiteful. These are all words applied to Lachesis. So let us see in the repertoire also. Malicious, very bad one. If you always criticize another one, he want to undermine another friend in front of others. This is called malicious. This is Lachesis. Malicious. So we'll have to learn good English to learn good homeopathy. Malicious. You see, malicious. Here, more is anacardium. Here, Lachesis is second grade. That's why we say this repertoire needs evaluated, improved, because this malicious you find in all the materia medica. This Lachesis is highly malicious, but in the repertoire it is second grade. It means it needs to be upgraded to the first grade. Maliciousness, spiteful, vindictiveness. Now you find haughty. Haughty means proudy. Oh, I'm the big one. Nobody's above me. All are below me. So proud. So you find the word haughtiness. H-A-U. Haughty. You find this sort of people among us, among your friends, among your relatives. Haughty people. Haughty, too much haughty. Lycopodium and platinum. You see lycopodium. Maybe when you study lycopodium in your materia, you don't know. Then it is so haughty. It is super great. It is much more than Lachesis. You see, Lachesis is second grade. Lycopodium is in first grade. Platinum, of course, is proudy. But even Lachesis is in the super grade. So you are learning materia of other medicine by doing repertoire. Now, loquacity, changing quickly from one subject to another. This is a characteristic of Lachesis. He will talk, and not talking in one subject. He will half finish one subject, then switch over to another. Let's see. Loquacity. Loquacity, changing. No. Loquacity, changing quickly from one subject to another. Exactly what Mathematics said. This is in the repertoire. You see, this is the only first grade medicine in the repertoire. They change quickly from one subject to another. There is no end to their story. So this is a very important symptom of Lachesis. So studying medicine from repertoire gives you the idea of the evolution of symptoms. This is a very intensified symptom or less intensified symptom. Now let us see another word, speech wandering. Same thing, quickly changing one subject to another. Speech wandering. He is wandering. We see pains are wandering from one part to another. Lachesis wander from one subject to another. So another rubric, speech. Speech wandering, you see, speech wandering. You see, Lachesis in the first grade. Of course, it should be in the first grade. His speech is wandering. Talking, wandering means traveling from one subject to another, from politics to literature, from literature to medicine, like this. Now, delirium muttering. Because we know Lachesis is a good medicine for typhoid fever, paratyphoid fever, blood poisoning, sepsis. So in that stage, patient has delirium muttering. So Lachesis is one of the medicines. So let us see also delirium muttering. Delirium. Delirium muttering. Muttering. You see, there is what you know. This delirium medicine we know in the repertory three big medicines: belladonna, hyoscyamus, stramonium, and also Lachesis in the second. So there is muttering delirium. Even in typhoid fever, Lachesis is used in typhoid and like typhoid fever. You see, there are bryonia, of course, a good medicine of typhoid fever, and also you find Lachesis in the typhoid fever. Now this is another symptom. We said that Lachesis has much anxiety about his heart disease. He thinks that he will die of heart disease. And this is a very intensified symptom in all the modern book of materia medica. So let us see in the repertory how it is represented. So let us go mind, delusion, heart disease, heart disease. You see, in medica, but in the repertory represented by heart disease. He thinks he should that he is having a heart disease. This is Lachen in the second grade. Second grade, you see in the grade. You can also criticize and evaluate the repertory. You can send a report to synthesis authority that this symptom, I think it should be upgraded to second grade, and you can give that reference. And if you send 50 such symptoms and they accept your 50 symptoms, they will include your name as a contributor in synthesis report. You'll find your name there. So I think this grade should be increased to at least second grade. Also, in fear, fear fair heart disease. Fair heart disease of heart. You see, also fear. Fear one here, this is heart rate. So it should be alluded to second rate at least. Go to fear of snake. You see, we think that fear of snake is too much in Lachesis. No, it is more in Lechem. When we will study Lechem in the next chapter, next phase, you will be very happy to know the comparison between these two medicines. Sometimes some people they mistake Lachesis for Lechem and mistake Lechem for Lachesis. You have to learn it very well to differentiate and correctly prescribe in a patient. So, fear of heart disease, fear of snake is a very important symptom of Lachesis. Fear snake. Let us see how it is in the repertory. You see, in the repertory, there are another snake medicine, elapsus heart disease, fear of snake, and Lechem. Lechem is not snake medicine, but it has most fear or about snake, more than Lachesis. Lachesis in the second rate and Lechem in the first rate. So when you study Lechem, these two medicine I tell you, if you learn very well Lachesis and Lechem, I think you will miss less patient having such symptoms. Or if you don't learn differences, you may mistake giving Lechem in a patient of Lachesis and giving Lachesis in a patient of Lechem, because they are very near their psychology. So we learn very well. Of course, we will do it. Now you can. We said that Lachesis is a religious affection. They think of religion too much. They are fanatics. They are fanatics about religion, and he is very pious. He is very religious, but he thinks that he did not do anything and God will punish him. So this is called religious affection. You find it in some places. So let us see in the repertory religious affection. Religious affection. You see, religious affection. Lachesis in the second grade, like also, and there is Lachesis as religious affection. This is the important symptom. Then too occupied religion. If we say he is too occupied, not any doctor, but he not go for peace. He is going to mosque here, there, and always think that he will not go to Jannah. He will go to, so that this is religious religious too occupied with religion. He's too occupied with religion. Always think of religion. Let us see. You see here, first grade. First grade is lilium tree. We learn Lycodium in the medical paper, but maybe we never thought that Lycodium has so much religious affection. But you see, it is same like Stramonium. Stramonium are very much religious. So, Lycodium patient, you keep in your mind. It is okay. You find some patient suddenly became religious, suddenly, and he's always thinking very seriously. So you must suspect that he has Lachesis mind. Now let us come also religious despair. He thinks that he will have salvation in the day of Hashor. In the Hashor, he will go to he will go to hell, not in Jannah. So let us see the symptom. He is so he has so despair, despair, despair. symptom. So let us say another one, then we'll go to repertory and we'll finish today. So this is head. Now let us come to eyes. Very important symptoms and very important medicine for some eye disease, I tell you. First thing is that this is enemy of sunlight, I told you. So Lachesis has intensive photophobia. He cannot see sunlight, even the artificial light at night. So this symptom is very important, though it is particular symptom, intense photophobia, number one. Number two, he has hemorrhage in the eye. Oh my God, it's very dangerous thing. Patient may have subconjunctival hemorrhage superficial, or maybe in the deep. There is retinal hemorrhage, retinitis, retinal inflammation, or even maybe retinal detachment, vitreal hemorrhage. Patient will say, since yesterday I cannot see anything by my right eye or by my left eye. It was good before, but now there is too much pain and everything blurring, blurred vision. I cannot see. Then she said, I went to the doctor. He said, you have bleeding inside your eyes and you need to have laser treatment to control this hemorrhage, to stop this bleeding. And it will take so much money. And she said, I don't have money. That's why I came to you. And we have a good medicine in Lachesis. Of course, not only Lachesis, there are other medicines. Lachesis, Crotalus horridas, phosphorus, arnica. These are very good medicine for hemorrhage inside the eye. Very good medicine. And if the Lachesis symptom fits, give Lachesis, no need of your laser or anything. So that's why this symptom you just keep in your mind. Hemorrhage inside the eye, particularly left eye, but you must have Lachesis symptom, mentality and general. Then you give, it's all right. You say this symptom, this Crotalus horridas, phosphorus and arnica. In ear, then I finish. Ear has not too much symptom of Lachesis, but a very good symptom. This is called Eustachian catarrh. I hope most of our participants here, you know the Eustachian tube, pharyngotympanic tube. There is a tube connecting the middle ear with the nasopharynx. This is called Eustachian tube. So you have any infection here, the child has tonsil, it will go to middle ear and there will be pus in the ear. There will be purulent discharge from the ear. This is called Eustachian tube. So there is Eustachian catarrh and the tube will be blocked by taking cold. The guardian will say the child took cold and he said he has pain in the ear and the pain, there is stop sensation. This is closed. He finds that he does not hear anything. Or maybe some patient will find they have tinnitus. They will say, I have noises in my ear. Noise in the ear from after sleep up to I go to sleep. Always various types of sound. There may be buzzing sound, there may be blowing sound, there may be sound of birds like this. So if it is on the left side, and if it is aggravated after sleep, Lachesis is a very good medicine. Left side and aggravated after sleep. Let us finish today our particular symptom. Inshallah, next day we'll start from nose up to finish. I hope next day we'll finish it. So I am going to repertory again only to show you that these rubrics, few rubrics. Going to repertory. Okay. Now let us see the symptom of head. I tell you the symptom of head because time is very short. That's why I show you the most important one. I say there is falling of hair in a woman during pregnancy. This is single medicine 5 grade. Let us go here. Let us go here. hair falling, pregnancy. You see, there is single medicine. That to first week. Hair falling during pregnancy. Single medicine first week. But it does not say that you find and give Lachesis, then there. No. It is homeopathy is not like this. But it gives you a good idea that the patient may have Lachesis symptom. Then you search other symptoms. If you find some other important generals or some mentals, you can give, and this will help the patient. Now let us see another symptom. Sun exposure to sun. Patient has headache from sun. This is important symptom. Let us see this one. Let us see symptom. Pain, sun, exposure to sun flow. You see, the patient has headache from exposure to sun. Particularly if it is chronic, Lachesis will come more. If it is acute, more will come glonoine, belladonna, antimcrude, bryonia like this. But if it is chronic, so you see, Lachesis is the first grade. Now let us go to the eye. The most important rubric I show you. I told you bleeding from the eye, bleeding inside the eye. So let us see the medicines. Bleeding from eyes. First is this one. You see, all the snake medicines have much effect on eyes, I tell you. So now we have started all the snake treatment. All will finish, inshallah. This Lachesis, then we'll go to Crotella, then we'll go to Elab, then we'll go to Botox. So we'll finish all. So here you see, bleeding in the eyes, Bothrops, this is a snake medicine. Crotella horridus, this is a snake medicine. Lachesis, this is a snake medicine. Also Elapse, snake medicine. But mostly you find Bothrops, Crotella horridus, Lachesis, phosphorus. And if it is from choroid, this is called choroidal bleeding. Lachesis is very big choice. And if it is retinal hemorrhage, you see, retinal hemorrhage from the retina, particularly those who have diabetes, uncontrolled diabetes, they will have first retinitis, retinal inflammation, then retinal hemorrhage, and there will be loss of vision. There will be retinal detachment. So you see, Lachesis is the only first-aid medicine in retinal hemorrhage. It is the only first-aid medicine. So if you have a patient of retinal hemorrhage and if you find other general and mental symptoms supporting Lachesis, you can give very confidently this Lachesis. Even retinal inflammation, retinitis is very common in diabetic patients and patients lose the vision. Let us see this one also. Retinal inflammation, and we will finish today. Inflammation retina. You see, inflammation retina, arnica, hypericum, Lachesis. Arnica, hypericum, Lachesis. And if it is hemorrhagic retina, you find Lachesis in the first grade. So with this, we'll finish today our lecture. I tell you, if we homeopath, we learn our materia medica very well, and we learn our repertory very well. You see, repertory, and my guru, Dr. Pramadanand Das of Sylhet, he used to say, repertory and mathematica are like twin brothers. One is indexed to other. How nice he was saying that. That guy, Pramadanand Das, he was BA in 1918 and DMS from Danhan Homeopathic College of Kolkata. He was the most senior homeopath of Sylhet, very good homeopath. He was my first guru. You are saying mathematics and repertory are like twin brothers. One is index to others. So we, even after this 4.5 decades, we find that his teaching is true. You learn mathematica and repertory well together, and this will help you in selecting your medicine in critical cases. So we hope to continue such teaching later on, and I hope those who are present in our lecture, they will learn our style of learning mathematica, and I think you don't find it in many other places. So this will help you, those who are very serious. If you see, your knowledge of mathematica has no bound. You can learn only from Gotok, 3 volumes of Gotok, and Oshut Porichoy, or maybe some other books. And you confine your knowledge of medicine of mathematica these books. Okay, it's okay. But you become a doctor, parivarik chikishok, domestic physician, or maybe you can practice in a small locality. But if you find in a place there very complicated patients coming to you from allopathic hands, from various districts of country, it comes to homeopaths. Then you cannot limit your study and knowledge of mathematica in such small books and easy books. You'll have to go to the source, as I said in my first lecture, primary text, secondary text, tertiary text, and also you learn mathematica by studying a part of bricks. Then it emphasizes and it increases your grips on mathematica. And I tell you that Dr. De Homeopath, who knows mathematica more than his colleague, then he's a better doctor than his colleague. You learn all the subjects, but mathematica too much, without any limit, without any bound, then you become a very good doctor. You know mathematica less, you are a less doctor. So please, this is only from my experience I am telling you, and the advice of my teachers. They emphasize the learning mathematica by any depth. So with this, I am finishing today. I am returning microphone to our anchor, Dr. Anwar Patwari. We can take some questions and then we'll finish maybe before 11. Okay, thank you very much for patient listening. Assalamu alaikum wa rahmatullah wa ma tawfiqi illa billah. Dr. Anwar Patwari.
আসসালামু আলাইকুম রহমতুল্লাহ।
ওয়ালাইকুম আসসালাম ওয়া রাহমাতুল্লাহ।
স্যার আমি মাহমুদ স্যার, আমি নাটোর থেকে শুনছি, দিনাজপুরের ফুলবাড়িতে আপনাকে নিয়ে কবিতা লিখছিলাম স্যার। আমি সেই মাহমুদ।
ওকে, থ্যাংক ইউ।
থ্যাংক ইউ স্যার। কোন ইংরেজি স্যার একটু আমরা বুঝতে পারছি না, তো স্যার মোটামুটি খুব ভালো লাগছে স্যার। আমি একদম শুনেছি, খুব ভালো লাগলো স্যার। এবং আমি 2বার আমার একটু নেটওয়ার্কের সমস্যার জন্য একটু কেটে বিচ্ছিন্ন ছিলাম। খুব ভালো লাগছে স্যার। আপনাকে অনেক অনেক ধন্যবাদ স্যার। আল্লাহ আপনাকে নেক হায়াত দিক এবং আমাদের অগ্রযাত্রা সফল হোক, এই কামনা করছি স্যার। থ্যাংক ইউ স্যার। আসসালামু আলাইকুম।
থ্যাংক ইউ। ওয়ালাইকুম সালাম ওয়া রাহমাতুল্লাহ।
থ্যাংক ইউ স্যার।
আসসালামু আলাইকুম স্যার। স্যার
ওয়ালাইকুম
অনেক
সালাম।
সুন্দর আলোচনা হয়েছে স্যার, খুব ভালো লাগছে স্যার। ইংলিশটাও বুঝতে পারছি স্যার, বাংলা ক্লাসটাও করব। স্যার এখানে অনেকগুলো মেডিকার নাম বলা হয়েছে যে আপনার লেকচারে। স্যার আমরা এই বইগুলো পাবো কোথায় স্যার? আমরা তো পাই না। আমি তো স্যার ময়মনসিং খুঁজি। হ্যাঁ, আমি ময়মনসিং দিয়েছি, ভর্তি হয়েছি হোমিও মেডিকেলে, কিন্তু এখানে তো কোনো বই পাচ্ছি না। একটু ডিটেলস করেই পড়তে চাই, কিন্তু এরকম ভাবে পাচ্ছি না স্যার। এগুলো কোথায় পাবো কি স্যার, এটা বুঝতে পারতেছি না স্যার। স্যার এটাই
You
আমার
see,
প্রশ্ন।
okay, thank you very much for your question. You see, mathematical study, I told you in my first lecture that it is phase by phase. You cannot learn all the mathematica at a time. So you go phase by phase. In first phase, you read some books and have some idea about the medicine. Then after some practice, some years, you take another phase of studying mathematics, and you enlarge your grip on books, and you collect more books and have more ideas. In this way, every year you are learning mathematics more and more. I started learning mathematics in 1977. Now also, I am now 67 years old, and I studied homeopathy since last 46 years. Still now, mathematica is a very good subject for me, and I study every day. And unless you study mathematica more and more, I tell you cannot be a good homeopath. No, you cannot be. And if you practice in Dhaka, you find nowadays so many patients, complicated patients coming to homeopathic fold to us for homeopathic treatment. We never saw such patient before 30 years. And to deal with such complicated patient, your grip on mathematica and repertory must be good, must be very firm. That's why I'm telling you, those who are serious homeopathy here, there is no alternative to learn mathematica so much, and your time of studying mathematica will you repay 100 times. If you don't know the medicine well, you know all other subjects of homeopathy, you cannot be a good prescriber. To be a good prescriber, you must have good grip on mathematica as well as repertory. Mathematica first and also repertory. Thank you.
Assalamu alaikum, sir, and assalamu alaikum to everybody who is attending the class. আমি শাহানা সিদ্দিকা। জি স্যার, আপনি একটা ওয়ার্ড টার্মিনোলজি ইউজ করছেন, disposition to contradicts. I have been confused about this thing. Yeah.
Yeah.
Can you please explain it to me?
Disposition means willing. Disposition means tendency to contradict. You say anything, I not agree. His father said, okay, let us go to market. No, I will not go. He will say, let us go to take bath. No, I will not go. So he has tendency to contradict to anything and everything. He does not like any authority, any order, any suggestion. No. What he knows, what he will do by himself, only this thing. This is called disposition. Disposition means tendency. Tendency to contradict the opinion or order or suggestion of others. Okay.
Okay, that means he doesn't want to listen to anyone.
Yes, anyone.
Okay,
he does not want
like he is the
authority. Yes, he's the boss. Yes, yes.
He is the
he
boss.
does not like any authority. He is not like any authority. You see,
Okay,
the difference between Staphysagrия and Lachesis. I tell you in this point.
Yeah, you mentioned about Staphysagrия other day too. Like, you know, if you are dominated by the Lachesis, and you're going to be one time you're going to be Staphysagrия. I just forgot about that. Yes.
So this Stephysagria just opposite to Lachesis. She or he
Okay.
will absorb the pressure by the husband, by the father. Maybe father is
Yeah.
very dominating. It does not give any chance to the boy. So this boy is afraid and he is just suppressing his anger, suppressing his desire, and ultimately he becomes ill. So this is Stephysagria. He is dominated,
Okay.
suppressed by his superior. Lachesis is just opposite.
In my mind, I was
contradict
looking for
any
that
authority.
stuff. I said, yeah, yes. That's nice. Yeah, thank you
Okay.
so much.
Welcome.
Yes, hopefully we're going to be together on like after Ramadan, I think after Eid, inshallah.
Yes, inshallah.
Inshallah. So yeah, it was. I feel like I'm just surrounded by the Lachesis like all the time. Thank you so much, sir. Okay.
Welcome. Yes.
Allah Hafiz.
No, he must change the name, then he will ask question. You tell him to change the name because we cannot count him.
স্যার আসসালামু আলাইকুম স্যার, আমার নাম রেবেকা সুলতানা, গভর্নমেন্ট হোমিওপ্যাথি মেডিকেল কলেজ থেকে স্যার আপনার স্টুডেন্ট। স্যার আসলে আমার আপনার স্যার কালকে বিগত যে ক্লাস প্লাস আজকে ক্লাস ম্যাম যে কোশ্চেনটা করলো কন্ট্রাডিক্টরি, মানে স্যার আমি জিজ্ঞেস করতে যাচ্ছিলাম যে চাইল্ড সিমটমে স্যার আপনি যেটা বলেছেন যে খুব জেলাসি থাকে, বাচ্চারা তার মানে ভাইকে সহ্য করতে পারে না। যদি আদার্স ধরেন কোনো ছোটবেলা থেকেই বেবি যদি এরকম থাকে যে মা তার বড় ভাই দিকে ঘুমিয়ে আছে, সেই ক্ষেত্রে সে মানে ভাইকে সরিয়ে দিয়ে তার পাশে মায়ের পাশে যাবে। এবং স্যার বড় হওয়ার পরেও তার যদি বিহেভিয়ার ডিসঅর্ডারের প্রবণতা থাকে, বা যে স্যার আপনি যেটা বললেন যে কন্ট্রাডিক্টরি সে ফাদার্স এর সাথেও করে, বা ওই যে স্যার আপনি লেকচারে যেটা বললেন যে সে কোনো অথরিটির কোনো কিছু মানতে চায় না, বিশেষ করে সে তাকে যদি পড়তে বলা হয় সে যদি বলে যে না আমার পড়া ভালো লাগছে না, স্যার এই ক্ষেত্রে কি মানে ল্যাকেসিস ইউজ করলে বা তার যদি হট পেশেন্ট হয় সেক্ষেত্রে কিন্তু তার ক্ষেত্রে স্যার কি বিহেভিয়ারের চেঞ্জ আসতে পারে?
Okay, thank you very much for your question. You see, I told in this lecture that nowadays we are receiving many patients. I tell you, every day few patients. Autism, ADHD. ADHD means attention deficit hyperactive disorder and behavioral problem. These three sort of patients, they are coming more and more. Why? Because they go to pediatric neurologist, child neurologist, and pediatrician, and psychiatrist maybe. But you know, in modern medicine, there is no curative treatment for such things. They only maintain, they only control the symptom. But in homeopathy, you know, because our etiology of disease is different than that of conventional medicine. So if you can diagnose his miasm and treat him, because these are not acute disease, this is miasmatic, came from father sometimes, from the family, from the environment, and you can select correct medicine, and you cannot expect that by a single medicine such patient will be cured, because Hahnemann said chronic miasmatic patient needs a series of medicine. Maybe first you find in his behavior there is syphilitic behavior, he's breaking this thing and that, you give him anti-syphilitic medicine. Maybe after some time you find that their symptomology changes, then you give another medicine which fits to the new situation, then another medicine, like this. So by a series of medicine, gradually you can cure the patient medicinally. And even if you cannot cure totally, but you can help the patient more than the modern medicine. So that's why you need not 1, 2 medicine. You need the whole Medica in your grip. But also, you will have to know that there is a group of medicines for groups of patients sometimes, because a patient of ADHD, attention deficit hyperactive disorder, they have behavior stereotype. If you take the history of say 20 patients of ADHD, you have the good idea about the ADHD patient, and also you have good idea about all the medicines which are having symptomatology like this symptom, and you study this medicine again and again, and you have a grip on that medicine. Then you find it is easy for you to select medicine for the patient. Now, for this patient, not only Lachesis, sometimes you find tuberculinum will come, sometimes you find tarantula will come. Patient says, mother says, child is very much fond of seeing music and dance, and sometimes he makes dances also, and he will act how his father is doing something. So this is just following others, acting others, and he's very much restless and just doing things and that. So you find that tarantula will come. Sometimes you find medorinum, very has much behavioral problem in a very restless patient. Sometimes you find buforana. Sometimes patient always handles his pennies and he has erotic behavior. One patient said, her child, only 5 years child, he said, always he comes to my loin, mother said, and rubbing his penis on my loin. You see, this is a symptom. She said. So you find other medicine, you find forana. So you cannot say that this medicine will cure this patient. You need a group of medicine, and you must be very much intelligent how to select medicine in each phase. Then you can help. Of course, this is a little bit tough to select a medicine for such patient who cannot talk. You see the behavior and you take the hints from the parents, and then you select the medicine. But it is possible. Thank you very much. Yes, doctor. Yes.
আমার আরেকটা প্রশ্ন রয়ে গেছে, I'm very stubborn person, so so you during the menopause you mentioned about like hot flashes is going from feet to head, right? What does it mean? Is that the hot flashes, but the patient কি মনে করবে যে ওর পায়ে থেকে গরম শুরু হয়েছে, এরকম বলবে?
No, he may say anything. He may say from feet to head. He may say from here, from heart. There is something going to my head.
I was a little confused about that. Okay, thank you, sir. Okay,
welcome.